My name is Mark Edwards. I'm the co-founder of Upstream USA. Half the pregnancies in this country are actually accidental pregnancies, and in low-income communities, it's more like 2/3. So literally 2/3 of the pregnancies are to women who know this is not a good time to have a child, but unfortunately, their contraceptive method fails them. And in this country, it's primarily the pill. What inspired us was a very powerful study in St. Louis about 2 or 3 years ago. It showed that when women were offered the full range of methods, same day, in an environment where they were counseled really well about what was most effective to least effective, they overwhelmingly chose IUDs and implants. They were more happier with them, they stayed with them longer, and they resulted in about a 75% reduction in abortion and a 75% reduction in teen pregnancy. These are massive outcomes that we've never seen. Of course, the whole educational and entertainment world didn't even hear about this. This was sort of narrowly focused on the sort of the reproductive and family planning world. But our view is that when women are able to plan their pregnancies and have children when they want them, lots of good things follow. Our goal is to ensure that women get same-day access to the full range of contraceptive methods. What the research shows is that when that happens, overwhelmingly they choose the most effective methods for themselves, IUDs and implants. Most health centers in the country don't even offer them, much less offer them same day. And so you've got this real mismatch between what's possible and what actually happens. But the real opportunity, I think, is to change what happens in health centers. In other words, right now, women are offered sort of a false choice. You can get the pill today, or you can take 2 or 3 visits to get one of these other really good methods. And so women often choose the pill, and they'll come back pregnant. Or they'll say, I'll come back for those other methods, and they don't come back, and they come back pregnant. And so what we're really trying to do is change what happens in that health center situation so that women really get real choice, which they can say, you can get any method of contraception free and available for you right now. What do you want? And here are the pros and cons about it. When we go into health centers, we recognize that there are multiple barriers to women getting access to these methods. One of them is just simply a clinical barrier. Literally, providers don't know how to insert IUDs and implants. These are the 2 really most effective methods, so we help train those. But that's not enough. You've got to make sure the health center can also bill for them and code for them and counsel well and schedule and all those things that make same-day availability possible. You know, having spent many years in the anti-poverty space, I've come to see how healthcare workers, in my view, really are the heroes and the ones who are at the center of sort of the economic opportunity, educational attainment conversation. Unfortunately, they're not. They're sort of sidelined, but they should be right in the heart of it, because when we get this piece of it right, it creates the opportunity for women and men and children to achieve all that they can. My name is Mark Edwards, and I'm an Ashoka Fellow.